I just wanted to start off by thanking everyone so much for attending our first community of practice for seniors medication safety. We're really, really excited to see so many people on the line. I see a lot of names I don't know, and many I do as well. If you're new or if you've met us before, sincerely welcome and thank you for coming. It's incredibly exciting to see this growing interest in seniors medication safety. For those of you who don't know me, my name is Jenny and I'm the Community Outreach Coordinator here at the Canadian Deprescribing Network. And I'm here with Justin Turner.
Hello, I'm Justin. I'm a pharmacist, originally from Australia, hence my accent. And I'm a researcher here at the Geriatrics Hospital in Montreal, and I'm also the Senior Advisor for Science Strategy at the Canadian Deprescribing Network. So thank you all for coming.
Yeah. So this past February, the Canadian Deprescribing Network held a national summit on medication safety for older men and women in Montreal. We had more than 30 representatives from seniors groups attending from all across Canada. We had groups like CARP, the New Brunswick Senior Citizens Federation, Community Links in Nova Scotia, the BC Old Age Pensioners Organization, and so many more. And we found that there was a lot of excitement and interest in learning more about seniors medication safety from those who were attending. And we found too that people were really keen to do something and to inform their communities. And one participant had this awesome idea to create a community of practice around medication safety for seniors. And so here we are today with the very first one. So to start, I'll just give a really quick technical lesson. At the bottom of your screen, there should be three buttons. We're going to use two of them mostly today. One is the chat button. So if you have questions or comments to add throughout the community of practice today, please, we'd welcome you to type them in there. And our communications director, Annie, is on the line as well, and she'll be helping us by answering your questions and things like that in the chat box. And there's also the raise hand function. And so there will be different occasions throughout this community of practice where we'll be asking questions, and we'd love if you'd like to say a word or something. So if you'd like to do that, please just raise your hand and we'll do what we need to do on our end so that you can speak and things like that. So I think we're ready to start.
Sounds great.
Maybe to test our chat box and our raise hand function, I will ask a question to start. We'd just love to know maybe what made you want to join the webinar today. Does anyone have an answer for us? Or maybe was it to bring information back to your organizations, or did you have a family member?
Unmuted by hold. Yeah.
Hi, Jerry. Do I hear you?
Can you hear me?
Yes, I can hear you. Hi, Jerry.
Hi.
Oh, you've lost the screen.
I've lost my screen, but I can hear you.
Oh, okay. Shoot, sorry about that. Did you want to tell us why you wanted to join the webinar today, or?
Yes, I wanted to join the webinar today to inform everyone that I'm the president of the BC Old Age Pensioners Organization, and since the conference in early February, I've taken the handouts I got from prescribing, and have been passing them around. And the reception I'm getting from my groups is phenomenal. And they are in the process of fitting me in so I can come and speak to their groups. Now, I've informed them that I will have handouts to hand out to the participants, and I've also stressed to the groups I was talking to take this information to their sons and daughters, and hopefully they will accompany them to their doctors when they make an appointment. And I've also stressed the fact to take all their medications and put in a receptacle and take to their doctors with them. And also when they make that appointment with the receptionist, I've stressed that they should book 2 appointments with their doctor so he will be able to accommodate them in the time slots, and they will be able to discuss fully their medications that they're now on. And hopefully the doctor will be able to eliminate some of them. I've also stressed that doing this now, they're prolonging their life because they could be putting their own personal health in jeopardy with their medication.
Wow, that's so wonderful. And you've been giving a few presentations a week in different workshops?
Yes, I do workshops for the University of Victoria and COSCO, the Council of Senior Citizens Organization. I'm on their board of directors. I do workshops for them, and I also do workshops on elder abuse. So I'm pretty busy with workshops, and I'm probably doing a couple a week, sometimes more, and I certainly enjoy getting out there and passing some valuable information on to seniors. So when I'm doing these workshops, I always fit the deprescribing spiel in at the end of the workshop, so that that's the last thing they hear when they leave me with their information.
Wow, that's so incredible. And are people receptive? Are they happy to get the information, or?
Oh yes, they're very accommodating in their thanks, and they're leaving with good intentions.
Wow. Well, you couldn't ask for more there. That's really wonderful. Yeah. Okay, well, thank you, Jerry, so much for sharing that. I think we're going to continue now, and Justin's going to give a little presentation on medication safety for seniors. And I just wanted to let everyone know beforehand that we'll be sending these slides out to everyone who's attending the webinar today in an email following the webinar. So, yeah.
Well, I don't think I need to talk. Jerry did a great job of talking for me. Thank you, Jerry. But we do have a presentation we've got here. So hopefully you'll be able to see it coming up on your screen in a second. Okay, I can still see people on the side, and you've got the hang of writing messages. Are you able to see the slides up on your screen now? And thank you, Anne and Joanna and everyone else that's been writing. Excellent, perfect. Thanks, Anne. I think you're all muted, so you might not be able to interrupt me as we go, but definitely if you do have questions, please write them in the side and we'll see them and answer them as we go along. So the talk will probably only take about 10 minutes and sort of explain. I know, as Jerry said, there was a conference that the Deprescribing Network held back in February, and we were really fortunate to have a whole load of people come, and it was fantastic. but not everyone could make it. Unfortunately, we couldn't invite everyone, couldn't host everyone, and not everyone did we know. And we've been really grateful to have new people on the phone today as a result of that conference or on the phone. So I guess this is just trying to raise the question of too many medicines. What's all the fuss about, or why all the fuss? So I guess the first question, and the way I always like to start talks on deprescribing, is why do we take medicines? And there's a couple of reasons. One, it's to improve symptoms. We might have reflux or heartburn, and taking some medicines like proton pump inhibitors can help reduce those symptoms. They're useful. It might be we use them to manage chronic conditions. So as we get older, we tend to be more prone to collecting chronic conditions like diabetes or high blood pressure or cholesterol, and medications are definitely useful in controlling those conditions. And the main reasons we want to high blood pressure or diabetes is to prolong life expectancy, so to prevent complications of disease and to help people to live longer. So up front, I want to make sure that we're all aware that life expectancy is longer now than it was 100 years ago, mainly because of a lot of the advances in medical therapy, including medications. However, as we get older, we get more and more chronic diseases, and we tend to get more and more medicines. And sometimes the benefits of the medicine may not stay the same over time, and quite often the harms of medicine might not stay the same over time. So for example, as we get older, our kidneys are less able to reduce the medication and then remove it from our system, so we might get medication accumulate. Or the little protective layer that goes around our brain starts to get a little bit porous, or it's like a really fine sieve when we're young, but as we get old, there's a few more holes creep in, and some medicines that would normally not be in the brain get access to the brain and might cause confusion or delirium or tiredness. So as we get older, the harm of medicines can sometimes become more pronounced. So I was going to ask a question, if you can put your hands up on that hands up button. How many seniors take a medicine? I think, hopefully I'll see hands go up if we worked out how to do that. Annie will tell me.
Yeah.
Yes, a few people.
Joan
cool.
Cochran, Leonard LeBlanc, Bren Joel, Anne Cooper.
Excellent. So I'm seeing a lot of names coming up on the screen. I won't read them all out because it'll take all day. But as you can see, medications are common. In fact, 2 out of 3 older adults in Canada take at least 5 prescription medicines, and 1 out of 4 of us take at least 10. And part of my research as a pharmacist is to look at what happens when we take too many medicines. And part of it's to see some of the harms of this due to particular medicines. So firstly, what do we call taking too many medicines? Well, it's got a technical term called polypharmacy. Poly meaning many, and pharmacy relating to medications. And in a research, and probably as a clinical role as a clinician, we normally refer to it as taking 5 or more medications. But I guess when I talk to patients, why is that important? And it's important because the more medicines we take, the more likely people are to experience drug interactions, falls and fractures, have memory problems, or worse, people get hospitalized or can die from too many medications and the harm that comes from it. But it's not necessarily always the counter medications, like how many we take. It can also be that some medicines are more harmful in older people than others. So this slide here, we talk about that. And we've got a term called inappropriate medicines, which we use in the research world. And really it basically means when a medicine, there's more potential for harm than there is potential for benefit. And we say that the balance is out of kilter there. And if you look at the graph on the right there, it shows you're at a higher risk of receiving an inappropriate medication if you're female or if you're over the age of 85. So it's relevant to this group here that Jenny's got together to talk about inappropriate medicines or too many medicines. Is there too many? And one of the questions people often ask me is, if these medicines may be harmful, why would the doctor prescribe it? And here's a slide that Annie's been fantastic at finding back from the 70s when the sleeping pills first became available. This one's oxazepam under the brand of Seropax. And it was advertised really widely to not only the medical community, but the public, saying you can't set her free, but you can help her feel less anxious. And it's showing a housewife, and there was a lot of advertising that made us feel safe about using these new sleeping pills because they were far safer than the old sleeping pills. And at that time, we didn't know much about the harms of them. However, we now know that they are harmful, and we're now trying to make sure we use them appropriately in the right people. So one question people often ask is, who is at most risk of harm from their medications? In this slide, we're showing that the more medical conditions you have, the more medications you have, and the more likely you are to have harms from drug interactions or side effects. Women win the lottery here more so than men. They're more likely to be at harm. And as we get older, so over the age of 65, which isn't really that old, we start to be more susceptible to some of the harms or side effects from medicines. So interesting statistic, putting it in the context of Canada, 1 in 200 older adults in Canada are hospitalised due to the harmful effects of their medication. And that's 5 times higher for seniors than it is for younger people because of the changes that happen when we're older, the increased risk of harm, and generally because we take more medications. So what can we do about it? And that's really, my life as a pharmacist was all about making sure people are on the right medications. And when I came to realise I was doing more harm than good, it really made me stop in my tracks and say, what can be done? And that's what drove me back to research. And I've researched deprescribing. So what does deprescribing mean? It's a word that you may or may not have heard before. And essentially it means we're stopping medicines that are either not beneficial or they may be causing harm. And the real goal of doing this is to maintain quality of life or to improve it. So we don't want you to get worse because of medication side effects, just like Jerry said. And sometimes we've got studies showing that people get better when we stop the medicines. But the important note at the bottom there is deprescribing should always be done with the help of a healthcare provider, be it your doctor or your pharmacist or nurse, depending on who you've got access to. So as a pharmacist, I know what I can do, but you might be asking, well, I'm a patient. What can I do about this? And there's a couple of things. Firstly, I'd like to say, educate yourself about what medicines you're taking and why. It's really important to know what medicines am I on. And the second one, and this comes from wise old people I used to work with, doctors and pharmacists, who would say, normally when a patient comes in, I talk about what's their most pressing concern, and we don't ever have time to talk about their medicines. So if you make a special appointment to see a doctor or a pharmacist or nurse about your medications, to review your medications, it's a great chance to actually start the conversation of, are these medicines right for me? Am I experiencing side effects? Can I take less? Do I need more? And see what we do from there. And I think that's really important. And it probably goes on to my next slide, because a lot of people tell me earlier in the slide deck, we showed that 40% of older adults take a medication that is potentially harmful for older adults. So why on earth did doctors let it get that high? And as a physician, I'd say, well, as a pharmacist, and I work with physicians, a lot of us say, well, we very rarely get people coming and say, oh, I want to stop my medicines. So we did a survey. One of my colleagues in Quebec City did a survey of older adults in Canada saying, would you be willing to stop your medicines? And have a guess for a second before I put up the answer. How many older adults do you think said, yes, I want to stop some of my medicines? Because I can tell you, when we ask healthcare providers, it's pretty low. If you want to put a guess in the box, by all means, put a guess in the box. I can't see any guesses in the box. It might be an IT glitch at my end. 15% from Anne. 1 in 4 says Claudia. Okay, we're getting higher. Very few says Joan. Claudia was on the right track and she was going higher from 15 to 25%. Anyone want to guess much, much higher again? And I'm glad you're guessing low because that's what doctors think and that's what pharmacists think. But actually, the research has shown 71%, thank you, Joanna, you've heard this before, 71% of older adults are actually willing to stop a medication. So that begs the question of what are we doing here today? What is Jenny really achieving with this? And we're really trying to spread the word about deprescribing. We talked in the last slide about what I can do for myself in making an appointment to talk to the doctor about my medicines. But in our roles within the organisations we represent or the organisations we work with, or hey, even in our roles as a spouse or a mother or father or brother or sister or a neighbour to someone, we have the ability to talk to other people about deprescribing and raise awareness and say, hey, some of your medicines might be causing harm. Have you ever had that conversation with a healthcare provider? And it's really important that healthcare providers are ready to have this conversation. We just need someone to start it. And healthcare providers aren't quite ready to start it, and patients need to take the first step. So one of the things that we've got on the back of our handouts, and we'll show the slides and the handouts next. Okay, I can see the next slide on the screen. Sorry, thank you, Joanne. One of the things that we've got on the back of some of our handouts are 5 questions. One is, why am I taking the medicine? What are the potential benefits and harms? Can it affect my memory or cause me to have a fall? Because as we get older, losing our memory or fear of falling becomes important. Can I stop or reduce the dose of this medicine? And how or when or who do I follow up with? So those are some important questions. Now, if you're like me, as soon as I turn the slide, you're going to forget. But that's okay, because we actually have those questions on the back of our resources. And I'm sure Jenny will talk about these a little bit later, but at the deprescribingnetwork.ca website, we've got access, as these ones talk about specific medications. This one's sleeping pills. This is some work done by the Institute of Safe Medicine Practices, which really great questions to ask your doctor about your medicines. And this is one of the brochures we've got free to download and free to hand out, which helps people to work out how to get a good night's sleep without medication. So I told Jenny I'd talk for 11 minutes, and it's 11 minutes and 3 seconds. So I'll be quiet now and open this up. I'm interested to hear, firstly on this slide, we have social media with Twitter and Facebook and emails, and we have the website. So interested to hear if that's of use to people and what websites or Facebook accounts they have, but also interested to hear if there's any questions about deprescribing and what you can do as an individual and what you can do as an organisation. So I'll pass it back to Jenny and open it up for questions.
Hi. So thank you so much, Justin, for the presentation. Just like we said, I'd love to know if anyone has any questions for Justin. To start it off, maybe we'd like to know if anyone knows anyone who takes 5 medications or more. And again, at the bottom of your black screen, there should be 3 buttons, and one at the very bottom says raise hand, and the other one says chat. So if you haven't found it, you're welcome to ask questions by doing either the raise hand or
the chat. You also may see your ability to unmute yourself down in the bottom left-hand corner. There's a little microphone symbol with a red line through. So if you can't unmute yourself, just click the raise hand button, and Annie can be a magician and work that out for it.
We have a raised hand.
oh yeah.
A couple raised hands.
Oh,
Oh,
great.
Dennis,
Denise,
sorry, are you there? Can you hear?
Yes, yeah, I can hear you.
Awesome.
Yeah, Denise, thank you. I'm at the moment a retired citizen, formerly epidemiologist, researcher, and I'm very interested in the topic, is the reason why I just recently met with Jenny as well.
yes.
And my question for you is that you did point, sorry, question, you pointed out the fact that the physicians or pharmacists were not aware. I'm curious about, once they are made aware, what does it involve in terms of time needed to perhaps help a person go through this process? Is it a very time-consuming effort? Does it demand extra visits to the physician? I guess I'm seeing this as being, maybe that's the pros and the cons of working on this issue.
That's a great question. Thanks, Denise. I guess I can answer it in 2 parts. Some of the research has shown that no, it doesn't take extra time for doctors. Some have looked at really time-intensive counselling sessions to stop benzodiazepines versus short interventions where a doctor hands out a brochure very similar to the brochure that we showed a second ago, which has a how to dose reduce, and they're found to be just the same. So I think we're working to get that message across to doctors that it is relatively easy. Now, the second bit of the question you asked is, how long does it take? to stop the medicines, and that is dependent on. So for example, some I mentioned for reflux medication, 1 in 4, 1 in 5 older adults in Canada is on reflux medication. And there's no good evidence to say that slowly reducing the dose is any better than quickly reducing the dose or just stopping it tomorrow. We know that 50% of people might get some symptoms of heartburn, come back as a withdrawal side effect, and we can control that with just using some Tums or some Mylanta or something when they need it. Whereas other drugs like opiates or sleeping pills, we do know that we have to be a bit more careful, and that may take several weeks or even a few months to gradually reduce the dose there. But time with the doctor is not long, or at the pharmacist. It's something that we can write out how to taper this, and all of our brochures have a guideline for how quickly can we reduce it. So that's something the patient can follow with some advice from their physician or pharmacist. But yeah, the whole process with the doctor is not long. The process of tapering depends on the medication.
Thank you.
We also have a question from Joanne Trimble. Joanna, would you like to ask your question?
It's actually not a question, it's more of a comment. And one of the things I think is important for people to know is that I know in British Columbia, and it's also true in Ontario, there is a billing code that doctors can use to have a longer consultation session with the patient. And if the patient doesn't know to request that kind of appointment, then the doctor could say, you know, I can't do that in 7 minutes or whatever. So it's worthwhile to try and find that out. My own experience with asking doctors to do medication reviews is not a good one for members of our family. They often, if you go to see your family doctor, they're very reluctant to take anything off the medication list that was prescribed by one of the specialists you might be seeing. And sometimes if they take it off, then they go back to the specialist, it gets put back on. The specialists are interested in the drugs that are involved with the particular specialty that they treat. So of course they always want those drugs to stay on. So there's more than just, it's not just a scientific, you know, we don't want drug interactions kind of thing. There's a culture in medicine too, you know, that you have to know about in order to be successful. I had one more request actually here. I'm wondering if Jerry Gosling can send me or put his email address in the chat box. I'd like to invite him to an event in Vancouver specifically on doing deprescribing in the community. It's a visioning day. Okay, I'm finished.
Perfect. That's a great idea, and that's, I think, what we're hoping to promote today, people who realise similar interests in similar areas.
Yeah, definitely.
And I'd agree, the whole reason of asking people to ask the doctor for a medication review is provinces like BC have this wonderful billing code. Not everywhere has it, but it's in BC, and it's a fantastic way to get your medicines reviewed. Provinces like Alberta pay pharmacists to do medication reviews, so you can just go straight to the pharmacist.
I know there's a code in Ontario as well. I was talking to an Ontario physician who actually teaches at McMaster, and she affirmed that there is in fact a billing code in Ontario that can be used for a longer session. Excellent.
Anne had a Cooper in the text box. Thank you, Pat. Yes, the BC pharmacists. Cool. Anne had a question saying, what about older adults, those that are over 80? Are they aware or conscious enough to think critically about the medicines? And I think that's a great question. On 2 parts. One of the reasons we're talking to you today is we can often advocate for those people. So it might be that it's the neighbour next door who is over 85 and has some problems with cognition. Knowing to ask the right questions or to give them some information to take to their doctor to start the conversation is something fantastic that we can do. Probably the other thing I'd say is I've worked in geriatrics for a long time, and I've seen some very fit 90-year-olds who are much fitter than some of the 60-year-olds I worked with. So I'm not sure that age per se is as much of an issue as the ability to be conscious and aware, but at the point where you're not conscious and aware of all your medicines, sometimes that might actually be a medication side effect. And I have, sadly, probably what pushed me into researching this further was I had a patient admitted to one of my nursing homes on several sleeping pills at once. And we gradually, over a few months with a local family doctor, stopped all those sleeping pills. And although she was in the dementia lockup ward, she was discharged 6 months later, perfectly lucid, perfectly able to speak, and perfectly and justifiably upset that her home had been sold in order to put her in a nursing home. So I think medication appropriateness is something that needs to be considered when someone is showing early signs of cognitive problems.
Now we do have another question from Claudia Penner, and that's, have you had the opportunity to present to medical community doctors, clinics, to share findings?
Yes, we have, and we are actively reaching out. So the Canadian Deprescribing Network has a couple of subcommittees, one of which is really focused on how do we reach older adults, how do we reach the public, how do we raise awareness, which is where Jenny's doing a great job with initiatives like this, and we're hoping this is really successful. One of our other subcommittees is really working on how do we reach the medical community. We're trying to get deprescribing in not only medicine degrees, but also the universities that do pharmacy and nursing and other allied health. So we are doing our best to reach out there as well. And I guess the third arm that the Deprescribing Network's working on is policy, to try and make governments aware and increase access to the great things like you've got in BC and Ontario, where we get funding for these things.
Okay, great. Now we have a comment from Joan.
Hi. So I've been a pharmacist since 1984. And I am actually very disappointed at the lack of leadership by pharmacists. And I think somehow we need to change the culture of patients that they expect more from their pharmacists. Like it seems like I have a medicine shop, which is a small pharmacy. So when you come into my pharmacy, you always talk to a pharmacist. But I know that that doesn't happen at some of the big box stores or even some of the, and so I think so there needs to be, and pharmacy is not going to change on its own, because unfortunately pharmacists like myself are a smaller group, but companies like the very large companies that own a lot of the pharmacies aren't really, they're more interested in profits than in, so things like medication reviews, now that we can bill for them in many provinces, what's happened in some provinces is that some of the bigger stores have set quotas, but not increased the resources to their pharmacists. So their pharmacists are doing what's been called 3-minute meds checks, where they just basically check off a list. So somehow we have to motivate pharmacists to change, but I think that the drive has to come from the public to say, hey, wait a minute, I'm not going to a pharmacy where I get pills in a bag instead of actually talking to someone. And I don't know how we drive that. I mean, I try and do that. I'm also on the board for the Council on Aging, which is why I'm at this meeting. I'm not, I kind of have two hats, but I do think that pharmacists need to take more of a role in managing medications, but doctors aren't really feeling comfortable to let them, because there's such a different level of service that people get. Doctors, I talk to my own doctor and she gets some quality feedback on medication reviews, but she gets a lot of junk that pharmacists are just making like a blanket recommendation. For example, saying, this is on the beers list, why are, you should stop it. But without really knowing and not having a proper consultation. Anyways, that's my opinion. So I'm done.
Couldn't agree with you more, Joan. As a pharmacist who used to own a small pharmacy rather than a big box pharmacy for the exact same reasons as you. So it's nice to hear a kindred spirit on the line. We are in the process of doing something in one of the provinces. I can't say too much until it's been officially signed off by government, but they will be empowering and paying pharmacists to initiate deprescribing. So we've actually got a project that will involve a whole province looking at how do we empower pharmacists to do that.
The trouble with that is that if there's...
Empower patients to go in and expect it and demand it.
Like the problem with that is that like too often that just is seen like it's seen as a revenue stream as opposed to improving patient care. And, you know, unless we can somehow get to a point where pharmacists are taking more responsibility for, you know, like pharmaceutical care, the official definition is the pharmacist taking responsibility for the outcomes of drug therapy. And we're certainly nowhere near that at this point.
I'm hoping we're making steps forward. I completely agree with you saying that patients need to drive it. And that's what we're here today to try and work out, how do we get this message to patients who live at home, and how can we, and how can Jenny, is in the amazing role that she's doing, how can she help support you and the other people on the line to get the message out, and how can we empower people to hear the message and take the next step forward?
Yeah. So one thing that we are doing is we're building a slide presentation. We've had some of the people who attended our summit last month have requested slides so that they can go share presentations to their organizations, communities. And so we're putting a slide deck together similar to the one that Justin presented. So we're going to be giving that to everyone, so you can have that information on your computers. If you have if there's anything else, if your organization is interested in raising awareness about medication safety for seniors, then we do have lots of ideas. We've been getting feedback from seniors organizations across Canada and getting lots and lots of great ideas from amazing people. So if you want to reach out to me, you should have my email. It's jenny.herbin@criugm.qc.ca, but I'll be emailing everyone after this session to give you the slides. So yeah.
Do we have, I know we're nearly at time, but I
Yeah.
saw that Leonard had his hand up and Herb's got his hand up. Leonard, you're unmuted. Did you have something you wanted to say?
Can you hear me?
Yeah, we can hear you.
Okay, 2 comments. I had a conversation with the New Brunswick Medical Society about your organization, and they're on board.
Excellent.
In fact, they're going a step further. They want to reduce people that go in hospital and take x-rays for nothing. They want to go that way. And this morning I saw my physician for a bad knee, a bum knee, but I talked to him about your organization, and he seems to be of the opinion that it's what we're doing is a good thing to inform the general population of over-medication.
Excellent.
And I said, if you can't give if the physician cannot give the right answer, can the pharmacist do that? And he said, absolutely yes. So that's just 2 comments. And we, as in New Brunswick, and I do that everywhere I go. When I make a speech, I talk about your organization, what people should be aware of, and to ask their doctor or their physician when they're taking medication. And I think that's the way to inform people.
That's fantastic. I'm sorry to hear you had a bad knee, but I'm glad to hear that
I got a hard time to walk.
Oh no.
It's a no hockey injury.
Do we have time for Herb to put his hand up as well? Do we have time?
Yeah.
Herb. Herb, did you have a question or did you have something?
Yes, I did. Thanks, Justin. Good presentation. I had put my question on the in the chat box, and it was really to find out. We know that based on the survey that was done in Quebec, that 71% of patients would be willing to reduce their medication. Do we have the same kind of a percentage for physicians and pharmacists of what they think their patients' willingness would be to quit or reduce medications? And the reason I'm asking is because we know that patients have a responsibility for their own health, but pharmacists and physicians do as well. So if we do, and we're focusing mainly on educating patients and the general public on the issue, but I think if we had those numbers for physicians and pharmacists as well, we could maybe find a way to emphasize with them to mention to their patients, you know, by the way, you're taking a lot of medications. We should probably set up an appointment to discuss this and look at ways to adjust some of this. So the question is basically, do we have those kind of numbers for those professions?
Yeah. Great question. And sadly, I'd have to say no. I talk to a lot of different healthcare providers, pharmacists, physicians, specialists, and every time I give a lecture at a university or in public like this, I will put rather than giving out the number straight away, I'll ask the question just to gauge what the audience is. And I've never had a group, pretty much like this morning, go above 25, 30%. I think if I ask individual doctors and individual pharmacists, they say, oh, I'm pretty sure a lot of people would. But I guess one way I can put it, so we had a study all about educating posting some of our information brochures to patients who lived in the community and were taking sleeping pills. And a lot of patients went to their doctor and said, I want to stop them. In fact, like 70% did. But when I asked doctors and talked to them about the study, and they're people who've been taking sleeping pills for 10 years, as a pharmacist, I would have said, they're the ones that don't want to stop. It's impossible to get them off a sleeping pill. But this study where we posted information and said, let's see what happens, proved me to be completely wrong. And all the other physicians and pharmacists that think like me, a lot of people are willing to. And I think there is a culture change starting to happen. And what we're trying to do with the deprescribing network is to engage people like you and Leonard and others to actually really get involved and sort of fuel this conversation and push it further. Because I think the more doctors hear it from patients, the more they're going to realise there is a culture change happening. The more they get to deprescribe and they go, wow, this is actually really easy. And like me, life-changing when I did deprescribe sleeping pills and had a patient come back from being demented. Much like Joanne with her mum came back once they managed to get a medication right. And I think for both Joanne and myself, that's changed our life course from there to try and spread the word and make sure that it's appropriate medicine for the right reasons.
Okay, so thank you, Herb. It's 1:44, so we're going to have to wrap up really quickly. I just want to let everyone know that the next Community of Practice will be held on May 23rd at 1 p.m. Eastern Time again. Before you go, we'd love to get your suggestions for future themes of future Community of Practice meetings. So if you have any ideas, things that you'd love for us to address and talk about, or tools that you'd like us to give out at these sessions, please let us know by email or in the chat box, or yeah, so that would be great. And we'd also love to know if this webinar, if this session was useful for you and if you enjoyed it. So we'd love to get all of those comments if possible.
We want to make it better, so help us to make it better so that we can be really useful to you, and we can help you get the message out. Does anyone have any suggestions quickly they want to put up on the chat box, or? Okay. Talking about CBT, so we could maybe have a session about CBT and how that's useful. So CBT, for those who don't know, cognitive behavioral therapy for insomnia, which is a good, actually it's better than drugs for helping improve sleep. how do we access it? What's it about? How do we do it? I think those are some questions we could definitely talk about in a session like this.
Okay. Yeah, we're getting some more comments, so thank you, everyone.
Thank you, Jenny.
Thank you.
And thank you,
Thank
everyone.
you, everyone. I guess. Oh, Joan has
we still have a question. Thank you. Joan's question, do you know if we will have a presence at the upcoming PAS meeting in Saskatchewan? I do not know, but I would love to hear more about it. If you're able to email Jenny, and then we can work on it from there. That'll be great. Thanks, Joan.
Yeah, we'd mentioned that, but there hasn't been anything. Okay, yeah.
Cool.
Yeah, we haven't talked to...
Brenda and I are due for a phone call, I think, this week or next week, to discuss deprescribing in Saskatchewan and how we can push this further. So yeah, that would be fantastic.
Oh yes, a dementia strategy. That would be interesting.
Something about dementia?
Yeah.
So things about sleeping pills, things about dementia. We have some tools and resources on reflux and heartburn, since those medications are really common as well. That might be something useful to talk about. Yeah. And I'd love to hear, like we did at the beginning, I'd love to hear from you what's been useful. What have you found that the groups you talk to like? What resources are do we not have yet that would be really useful? Like, I don't know if Jenny's told you, but there's newsletter articles that we've written that can be easily put into newsletters and things like that.
Okay, well, thank you so much, everyone. Hope to see you next time.
Thank you.
Thanks, everyone. Look forward to seeing you soon.
Bye.
Bye.